gave you your first pin. There you go. Do you see him fishing? Fishing, dude. I don't know, whatever. Very good. Hey, congratulations. Thank you. We'll be here in 3 minutes. Everyone's surprised. Just as surprised as you. I know it came together. Thanks for that together. Get it out. On the stuff here. Hush. Dave and Amanda. Here's young man. We have a 20-year pitch.
It's really fun.
It's been truly a pleasure getting them.
Yeah.
I mean,
Perfect.
And next is Tasha's. Come on, yeah. Which one are you? Anastasia. Come on. Come on. Your health. Exactly. Come on over. Davey and you. Thank you for working on it. That's right. Okay. Well, we're glad you are. Here we go. Sorry, Eddie. Not yet. Yeah, you can just go out here and we'll take a picture. All right. Come on there. Figure it out. You started out 2 months. I was gonna say I would. Not too long. And then all right. I don't know. Thank you. Yeah, the pictures away. Anyone else? Hold on, speaker. Oh, let's play the video. Okay, I can do that.
to work longer together, but those times that we did were awesome. You're a great leader. We'll miss you. Those are big shoes to fill, and best of luck moving forward with everything.
Kevin, happy retirement. It was a pleasure working for you. I especially appreciate all the help during the COVID-19 response. That was huge. So, hey, you earned it. Good luck to you in the future.
Hey, Kevin, this is Josh, obviously. Thank you for everything you've done for us, and hopefully you have a great retirement, and we'll see you around the neighborhood.
Hi, Kevin. Thank you for everything, and enjoy your retirement.
Happy retirement, Kevin.
Enjoy your retirement.
Hey, Kevin, it's Craig, as you know. So really appreciate your leadership, both here in air quality and also with the health district. And I'll never forget the time where, as division director in air quality, you came out in the field with me up on the roof, climbed the ladder, and helped me change out some filters. So I'll cherish that memory, and thanks again for your leadership.
Hi, Kevin. Happy retirement. Thanks for everything you did for us. Appreciate you. Take care.
Kevin, I just want to thank you for making health equity a priority, and I'm wishing you a very happy retirement.
Hey, Kevin. Good luck on retirement.
Thank you for everything, Kevin. Wishing you the best of luck in retirement.
Hey, Kevin. This is Dave Kelly. Happy retirement. You went through a lot while you were here, and I appreciate everything you did, and it's well deserved. So I hope you enjoy it.
Thanks, Kevin, for all your work. Hope you have a great retirement.
Hi, Kevin. This is Susie, your assistant. And I just want to say, remember the time when I didn't leave you for a certain entity that wanted me to move with them? Yeah. You betrayed me, but it's okay because I know you're moving on to bigger and better things, and I couldn't be happier for you. So congrats on your retirement, and best wishes on your new endeavors. Take care of Tommy.
Happy retirement, Kevin. Hope everything goes great for you.
Happy retirement, Kevin. It's been an honor and a privilege to know you all these years, and you've done a great job as director. Thank you.
Hey, Kevin. Thank you so much for everything you've done for the community, especially during the COVID pandemic. Best of luck in retirement, and hope you have a good time.
Happy retirement. Enjoy it. And hopefully we don't see you around. That way you enjoy the retirement.
Hey, Kevin, I just wanted to say thank you for all your contributions in my time here at the Health District. You kind of set my career on a different trajectory, but it was a good change, and it was welcome, and it's been a fun ride. So wish you well, and good luck with retirement.
Thanks for everything, Kevin. I wish you the best retirement and have tons of fun.
No comment.
Thank you, Kevin, for everything that you've done for us. It was great with the past year that we've worked closely together in regards to CCHS grants, and good luck to you, and enjoy your adventure.
Like I always say, a short time, but it was a good time. Have a good one.
Thanks, Kevin. Enjoy your retirement.
Enjoy retirement, Kevin.
Hi, Kevin. Thanks for everything you did for Northern Nevada Public Health and me as a boss. I really appreciate it. I hope you have a great retirement, and say hi to Tommy.
Thanks for the opportunity to work with you, Kevin. It's been an honor. Congratulations on your retirement, and enjoy your new life.
Bear with me for a second here. I'm going to bare my soul. I can barely believe it. You're leaving us, Kevin. I'm just so stuffed full of gratitude for all you've done for the district and for me and my professional development. Thank you very much.
Hey, Kevin. Congratulations on your retirement. Thank you so much for all your support and guidance, and most importantly, thank you for your humor. Your wit just has carried me through some difficult conversations, so I appreciate it. Have fun and enjoy.
Enjoy retirement.
Kevin, wishing you the best in your retirement.
Good luck, Kevin. Wishing you the very best. We enjoyed working with you.
Hey, Kevin, it's Yera. As part of the comms team, we cannot confirm nor deny that we will miss you, but we are eternally grateful for everything that you did for the team and for NNPH, and I hope you have and enjoy a great retirement.
Hi, Kevin. This is Brandon with Air Quality. Wishing you the best in retirement. Thank you for everything you've done for the Health District.
Hi, Kevin. I just want to wish you a happy retirement, and thank you for all your years of service for Washoe County Public Health.
Thank you, Kevin, for all you've done for our community. You will be greatly missed. I would say come back and visit, but let's be honest, we'd really rather have Tommy come back and say hello.
Irving and I would like to wish you a very happy retirement and enjoy yourself.
Thanks, Kevin. Happy retirement. Thank you for all you did, especially during the pandemic, the leader we needed. I hope you have a great retirement and get out there and explore and have fun. Thanks.
Congratulations on your retirement, Kevin. We've enjoyed your leadership over the many years. Enjoy.
Hi, Kevin. I just want to wish you luck in your retirement and thank you for all you did for Northern Nevada Public Health, especially during the pandemic, and just everything that you did for me as a leader in this organization and all of the mentoring that you gave me over the years. I really appreciate it, and we'll miss you.
Kevin, you can't go because I've never had the opportunity to be as awkward as frequently to someone so important, and we have this great rapport, and I can't start over. I hope you enjoy your retirement.
So that was from your staff, but I do want to thank Scott, Noah, and Yura for helping put that together. But a lot of people have a lot of good things to say, so congratulations. Can you guys hear me again? John?
Yes, I've got you.
Yes, I can hear you.
Okay, awesome. We still have our quorum. Just wanted to make sure. For the record, I want to say, oh, there you go. Whoa, we're getting technology's working again. And for the record, Mary Luz Garcia is in the building, so she's here with us. Thank you, thank you. Did you want to say anything, Kevin? Okay, we already kind of thank you. Okay, she's waving at you. We think you're awesome.
Chair, I just want to make note of the exact time that Commissioner Garcia joined us was 1:28 p.m.
Thank you so much. So we're going to go ahead and move on to public comment. Is there any public comment in the building?
Yes, Chair, we have Miss Molly Rose Lewis.
She is always welcome. No.
Sorry. Hi, everyone. Rose Lewis, Senator Jackie Rosen's office.
Give us, hang on 1 second, because I think that that phone is not unmuted.
Okay. You're good. All right, I'll start that again for folks on their phones. Hi, my name is Molly Lewis, Regional Representative covering healthcare for Northern Nevada from Senator Jackie Rosen's office. Yet again, I do try to come when I can. Just wanted to I think whoever's still here, to congratulate you on all of your accomplishments. Welcome, Kingsley, and thank you on the right, Mr. Dick, for all of his work, especially through the pandemic. I know our office really appreciated everything you did, and I believe there's something en route from the senator for you. So watch out for that. And as always, we are available to help with federal grant issues, with direct federal casework for constituents and all of your staff and everything else. So please let me know how I can be of assistance. Thanks so much.
Thank you. Any other public comment?
No more registered public comment.
I'm sorry, say that again?
No more registered public comment.
Thank you very much. So we're moving on to consent. Does anyone pull anything, or do you looking for a motion?
Motion to approve the consent item.
We have a first. Do I have a second? First and a second. Any more discussion? Hearing none. All in favor?
Aye.
Any opposed? It looks like it passes unanimously. So we're moving on to budget. Actually, yeah, we're moving on to 7. Let me get to my spot. Seven, Regional Emergency Medical System Authority. Rems, if you'd like to come on down, Mr. Adams.
Thank you so much. Good afternoon, Mr. Chairman, members of the board. Adam Hines, Chief Operating Officer for the record. Welcome, Dr. Kingsley. And on behalf of the entire Mental Health Organization, Mr. Dick, thank you so much for everything that you have done, attending our board meetings, supporting our organization, and really being in the hottest seat during an unprecedented pandemic. And that leadership was tremendous. So thank you so much, and we wish you the best of luck. I understand before you have a copy of our April report and a couple highlights for April and fiscal year to date. Remsa Health continues to exceed franchise response compliance for Priority 1 calls in all of our zones. In the month of April, we responded to over 7,900 calls, which was a very busy month, and we anticipate the month of May to be busy as well, with over 5 patient transports, which is actually a 5% up month over month, with our average response time being 5 minutes and 46 seconds. In addition, the last month we worked with the EMS oversight team, which I believe eventually will come before you, to review our response zone map. This is done every year to ensure that EMS coverage in our community continues to evolve as our region grows. This ensures that there's appropriate coverage based on population, is really the determinator whether something is a zone A versus a zone B, C, D, and E, is based on that population. And so that will come before you, but that was something we did. And then finally, it's the EMS week. And so we are extremely proud of the work that our men and women, 600 strong, do every day at Remsa Health. And it was an honor to celebrate them not only at our annual awards event, which many of you attended. And so I thank Dr. Kingsley, retired district health officer Dick, Councilman Reese, and Councilman Dare for being there, really honoring the past and forging for the future. Which is the theme, and its 50th anniversary. And so with that, I would be happy to entertain any questions you may have regarding my report or anything else.
Are there any questions? Anything online? So I would just like to say great job the other day. It was fun getting together and celebrating EMS week with you. And obviously we encourage you, please take a hearty hello from all of us back to all your workers, but also to their families. I don't think people realize the sacrifices these families make. So thank you so much. I am looking for acceptance of this report. I have a first, do I have a second? I have a second. All in favor?
Aye.
Any opposed? That passes unanimously. Okay, we are looking for the recommendation to uphold the decision of the Sewage Wastewater Sanitation Hearing Board to approve variance case H24-001 VARI of the Northern Nevada Public Health Regulations governing sewage, wastewater, and sanitation for Lacey Ruley and Robert Van Louis, owners of the 460 Nicole Drive, Washoe County, Nevada Assessor's Parcel. And I have Latricia Lord. Hello. And if we need Dave Kelly somewhere. So
Dave Kelly went back to his office. For the record, Latricia Lord, Senior Environmental Health Specialist with EHS. Dave was actually out of town during this Sewage, Wastewater, and Sanitation Board meeting anyways, so I kind of took the lead on it. As you can see from the staff report, the variance case was the result of a septic system at 460 Nicole Drive going into what is considered failure, backing up into the home. And there is municipal sewer available, but the homeowners of this property asked for the variance to still install what is considered a repair field rather than connecting to municipal sewer due to financial hardships. They provided quotes from two different companies to connect to sewer versus constructing the repair leach field. As you can see, the ranges in the staff report, constructing the leach field was anywhere from $15,000 to $28,000, and connecting to municipal sewer was anywhere from $78,000 to $85,000. The property informed that even if the variance is granted, all applicable regulations would still need to be followed, and they do have sufficient space to do so. So it would be the equivalent of the status quo rather than connecting to sewer. The case was heard by the board on May 2nd, and they voted to recommend approval of the variance to you all.
Very good, very good. Any questions on this particular item? I don't see any questions, so thank you so much. Thanks for handling all that and making sure that all went well. And with that said, we are looking for acceptance of this. Do I have a motion?
So moved.
I have John Novak with the first. Do I have a second?
Second.
Mike with the second. And John with the third. And so all in favor? Aye.
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 Any opposed? That passed unanimously. Good job. Thank you so much.
Thank you.
Okay, we are now looking at the approve and adopt the proposed Northern Nevada Public Health Employee policy manual updates for wellness, health insurance, Portability and Accountability Act, confidentiality and security protocols, refunds in the workplace. And you're not Jack Santino.
No. Good afternoon. For the record, Erin Dixon. I'm filling in for Jack on this item today. Before you are 4 policies to be added to the employee policy manual. 2 of these policies you've already seen and approved, but they were inadvertently not the policy manual. The first one is the refund policy, which came before you and was approved on July 28th, 2022. And then the relationship in the workplace, which was approved February of this year. The 2 new policies include the HIPAA confidentiality and security protocol. So these protocols are components such as securing of physical documents to our HIPAA policy. These are already being in our other divisions that deal primarily with HIPAA, for example, CCHS. So this change is just to include it for all divisions. The 4th policy, we need to document our support for employee wellness and document all the resources that are available for staff. You will notice in there that primarily these resources are being provided by Washoe County, as we are Washoe County employees. And so this policy documents those resources and in an easy location for staff. And those are the 4 policies before you.
Thank you. Any questions? I hear none. I do want to say I really appreciate us reading through the wellness policy, and I love that we have more and more find ways to take care of our staff. I know many of them we already do, but I like that it's written and put in place. And so good job on that, and good job staying with us. Thank you. So with that said, I'm looking for a motion. I do have a first. Do I have a second?
Second, John.
I'm going to take John's second. All in favor?
Aye.
Any opposed? That passes unanimously. Okay, we're moving on to our staff reports. Air quality, come on down. Francisco Vega.
Thank you, Chair, for the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I did want to highlight one part of my report, which was the American Lung Association releasing its 2024 State of the Air report. Again, just want to kind of reiterate, this is my report, but although it's the 2024 report, the data that is used for the grades is from 2020 to 2022. And this is for ozone and particulate pollution. As you stated in my report, Washoe County received a failing grade for both short-term particulate pollution and ozone pollution. And again, we ranked 19th for worst, 19 worst for high ozone days of 228 metropolitan areas. Ranked 6th for 24-hour particulate pollution out of 223 metropolitan areas, and 18th for annual particulate pollution out of 204 metropolitan areas. Again, this is kind of a quantitative way to view the air during this period of time. This is not really a reflection of our organization, so I want to make that part of it clear. Again, this is, if you're grading the air that we breathe during that period of time, it was not good. Now, we all know that we were being impacted by wildfires, and that's primarily the cause of the grade there. But I do want to point out that of the 68 days during this time period where we were unhealthy for sensitive groups, there were 3 to 5 days where we were being impacted by local sources. So it's not just all wildfires, and I want to kind of point that out as well. I did have an opportunity to kind of sit down with this is Reno for an interview on this report. It was really good, and really the biggest thing I wanted to highlight there was we appreciate our relationship with the American Lung Association. They do a lot of really good things in cleaning up the air and making sure that everything that we breathe is healthy. So I wanted to point that out, and again, just wanted to highlight those few things in my report, and happy to answer any questions.
Any questions? I have one, because I look at this and we got an F, but we are in attainment at this point, right? So when I look at, I think we just need to make sure, I know you said you met with This Is Reno, but if there's other ways that we can tell the whole story, would be helpful to some of us who get to talk to people all the time, because all they do is pick up. Right. And so we need a little bit potentially to those out there. And I think without question during the days, there's days we couldn't even walk outside during some of those days, but that needs to be explored a big portion. And I know we want to be careful that we don't let off the pedal of keeping everybody going. But when we have people walking around just thinking our air quality is just F all the time, that's not healthy either. And so if we can find a balance in that, and I know you're trying to, but I can tell you lately I've heard about our F more than I've heard about anything we are doing. So if that's an encouragement, it might be nice.
Yeah, thank you for that sentiment. It is important to note as well that the calculation methodology that American Lung Association uses is different from the EPA. So it's important to understand that. So while, again, we all recognize air was not healthy during this period of time because of wildfires, you are correct that, again, it's not all doom and gloom. Again, for the most part, the air is pretty good. And again, there are those few days, but again, there's things that maybe we can do locally to improve as well.
Total. And I'm just hoping for some balanced information out there. Not that you're not giving it, but maybe we could find some better. So thank you.
Yep.
Okay. We are moving on. Lisa, come on down. Community and Clinical Health.
Good afternoon, Lisa Lottridge, Director for Community and Clinical Health Services. I just wanted to start that this May is Adolescent Health Month. And on April 20th, our team partnered with Planned Parenthood for the first LIFT class, which is linking families and teens. And we had 9 teens and 7 supportive adults participate. And we're hoping to have another class in fall or winter and include bilingual participants in that course. Next, I wanted to mention that we were notified that the Bridge Access Program will end at August of 2024 this year when the doses of the current COVID vaccine expire, the current formulation expire. This program has been crucial in providing access to the COVID vaccine for our uninsured clients. There was a meeting this morning for the Bridge program, and everyone is, discussing the importance of finding some way, either at the federal level or at the state level, to purchase this COVID vaccine so we can make sure that our uninsured clients do receive the vaccine. So I will keep you posted on that, but I wanted to let you know that is occurring, and we were just advised this week of that. And just to give you an idea, October of 23 to May 21st to 24, we at NMPH dispensed 474 doses. It's called 317 vaccine, a COVID vaccine. So we dispensed 474, and 331 of those were off-site, and 143 were here in the clinic. So we definitely want to find a way to continue to serve our clients with that. And then lastly, we had a Family Health Festival last night, and staff was very grateful that Dr. Kingsley was there to join them. And it was a busy night, and it was our first Family Health Festival without Immunize Nevada support, so we're still working it out. But we served 44 individuals, and so it was busy for us. I know that doesn't sound like much, but when you're giving 8 vaccinations to one person, it's a lot. But they had a good night, and looking forward to the next one. And I'm happy to answer any questions.
Any questions or thoughts?
It was great to see the participation and how well it flowed, but also the community partners there, so they could walk in the door and find that specific resource that they needed, and see how they learned and throughput and everything that was really good. I mean, with the community members that are valuable going to them, and providing that increased access for them, especially in that region, that community that needs that. It was wonderful of them to be there. And then the community and clinical services, they did a wonderful job last night. I practiced my Spanish a little bit towards the end. So wonderful. So, thank you.
Very good. Thank you. Appreciate it. We have environmental health services and Robert Fida.
Good afternoon, Board. Robert Fida, Environmental Health Services Director for the record. So you have my report in front of you. I'm going to highlight a few things. One of them I wanted to highlight is that we had our first helicopter treatment, occurred May 16th. So that went obviously. And then the other thing is we are also kind of preparing some of our drone work. Our staff has been in the field. They've been kind of calibrating the drone. They've been testing essentially costs, how much density they can lay of product under various settings. So they are, I think, refining that, and they should be ready for public flights. I think later this month or next, later this month or next month. And then the next I did want to highlight was the Rosemount Water Company. We have discussed this one. This is the water system that does not have a operator, and they are in no ownership. And the PWC or Public Utilities Commission is involved in this one. And to kind of highlight some of staff have actually processed all the missing water quality monitoring for 2023. And we issued essentially 26 different violations. 22 of those went to Rosemount for monitor for disinfection byproducts and uranium. So. And then last thing I did want to highlight is that our food team did a virtual presentation for the National Environmental Health Association, and they did it for the Program Standards Symposium. And their title of their presentation, Food Safety Resources, Create Once, Use Many Times. And it was kind of focused on development of all our various resources, including the active managerial control programs. Those are kind of the highlights. Let the board know. Any questions?
Any questions or thoughts?
I want to recognize the Director Bourne that we have a drum last month. So fun exciting stuff there with our larvicide distributed key areas that are difficult to reach. Wonderful advancement there. Just want to recognize that was publicized in the media. And I just want to say I did my first environmental health ride along with one of the services this week. It was great up to see that and really see how be a resource to the community to make them thrive and successful in their businesses. And as well as ensuring that many times in our state public health we don't get thanked for the mosquito bite that they're worried for, health staff and the relationships and professionalism to have with our community partners and our business to make them successful and thrive. So thank you.
I have a goal of, to control the drone. So anybody want to join me, let me know. But I also want to say, what are we doing to prepare all of our vendors for what's about to happen with events? We did have a few extra emergencies that were unnecessary last round. Are we communicating with everybody expectations as we come up to the event season?
Yes. The food team actually did a temporary food event town hall, and so that was designed to communicate changes in the permitting that occurred, as well as highlight some of the mistakes that they find during inspections. That event was a few weeks ago, I believe, and we didn't have too much attendance. It was virtual and in person here at the Northern Nevada Public Health. I believe we had about 4 attendees, but we are trying to push that online as well, so that it will be a resource for the community.
Part of me wonders if we have people who struggled last round, if we just remind them to watch this. I just say we obviously have a lot that goes on in the next few months, so it's whatever we can do to communicate. I also want us to know as a board that when people call you and they're upset, is that we've done all that we can to help them do it right. And so, but if we can make sure that just continue to find ways to do that, would be great. Thank you. Awesome. We're moving on to epidemiology and public health preparedness. Dr. Nancy Dow.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So you have my report. I don't have anything to change or add, just a few highlights. In the preparedness area, on May 14th, Northern Nevada Public Health and ITC held a mass casualty incident full-scale exercise near the Nugget Event Center with involvement from City of Sparks, hospitals, fire, EMS agencies, law enforcement, emergency management, and other healthcare facilities in region. There were 35 volunteers who were moulaged to replicate injuries from an explosion. The exercise tested our NNPH mass casualty incident plan, specifically focusing on transport components and surge of emergency departments. Exercises like this, as always, are important steps to help improve community preparedness and response coordination across different jurisdictions. And also lessons learned from this particular exercise will be incorporated into our mass casualty incident plan update, which we're scheduled to update by the end of June of this year. And in epidemiology, the 2023 to 2024 influenza season ended officially on May 18th. So we will be producing our week 20 flu report this Friday, and we will have also an end of season summary produced very soon following that. During the season, flu associated hospitalizations totaled 453, with the highest numbers occurring between late December 2023 to mid-January 2024. And also hospitalized, most were infected with flu A, and the majority were not vaccinated. Flu A was the dominant influenza type from the start of the season and during the peak activities. And then by the spring of 2024, flu B started dominating over flu A, but with no further concerning surges that we're seeing. There was a total of 2,846 reported RSV cases this season, and this exceeded last season's record of 2,045 cases. The peak of RSV cases this season were between December of 2023 and early January of 2024. And that's all my update. I'm happy to answer any questions you may have.
Any questions from any? I only have one. I heard about some little bit more COVID happening amongst some of our seniors in senior home. Have you heard any of that? Is there an uptick?
I've gotten that as outbreaks coming to us right now, so we will keep an eye out.
Thank you. Appreciate it. Thank you so much. And now, Dr. Chad Kingsley, you get to give us your first update. What you got?
So, Lobster, this is Kevin's update for the month of April, but just going to review over some of the great stuff that's happened. Just with our great transition of wonderful staff and genuine of staff for the transition of the district health officer, all is going well. Touch on communication. So April was National Public Health Week. Continued with all of our daily social media posts and press releases announcing those things to highlight Public Health Week. We had emergency response exercise regarding a ricin outbreak, so it was a practice. We did communications held up at Joint Information Center, and again coordinated with media and interviews. These are always important to help us prepare for if and when these cases may occur in our community. Comms also participated in the Take Back Day as well as Biketopia. You guys recognized that last month, but went well, and as well as facilitated the bi-weekly restaurant inspection report with the Reno Gazette Journal. Accreditation continues forward for our July 2024. Already meeting 100% of some of our deliverable of our domains and continuing forward there. Using that as a correct tool to always help us be able to understand and meet the needs of our community, as well as internally, so that we are best presented to be able to do that, but that progresses forward well there. Quality improvement, so agency-wide results from our QI survey has been shared with all our staff, along with analysis of the general areas, and division-specific results were shared with each division director for those QI process. And then just as a reminder that our QR committee was started back up, and being able to start and do great things to be able to help in the quality improvement process that should be staple to our department. So They're planning an in-person advanced QI training delivered by renowned outside consultant QI Kusin. So we're continuing forward with our QI process. Workforce development is expanding the new employee onboarding program with videos and webinars for staff. Previously, we had done in person, but this is part of that, be able to streamline and be as effective as we can. We're excited for that onboarding program to really help bring our new staff up to speed and welcome them in and understand the culture of our department. Community health improvement continues forward. We recognized already and spoke about the Family Health Festival 2024. Went well, and as we continue for planning, currently there's 3 a year that we plan, but we'll be bumping back up to 4 eventually. But great opportunity there. I also want to recognize Acá Entre Nos, which is here between us. It's a focus on increasing collaborative opportunities with the Washoe County School Board. We presented to the program of Acá Entre Nos that was delivered to Washoe County School District. Some very interest there and hoping to continue to develop that relationship with them in the school system. Equity projects, the health equity team met with the Washoe County Human Resources, receive a demonstration on Wordly, which is a transcript translation tool for approximately 50 different languages. So looking to increase access there for any that are seeking access across the county. Northern Nevada Public Health is, we're partnering with to help promote a survey focused on the most impactful and feasible ways to reduce greenhouse gas emissions. We're making sure, as part of this is that when we do these surveys, that there's a health equity lens put on it, that we're meeting the correct people and getting out to all those, the diversity of our communities so that we have a fair representation. So some great points there and continuing forward on that. And then community events, just to highlight, there was the Asian Community Development Council. They invited us to part in the Thai New Year Community Resource Fair, and that was April 21st. There was a COVID outreach team that provided COVID and flu vaccines to community organizers and helped table a community to connect community members to our services. And lastly, the team attended Older American Fair hosted by Washoe County Health and Human Services. And we connected with over 118 seniors about fall prevention tips, clinical immunizations, and physical activity. And that wraps it up. Thank you.
Any questions? Any questions online? Do any of you guys have any questions or thoughts for Dr. Kingsley?
No.
I don't hear it. Nope.
Just like the public report, just in the transition of things have gone very, very well. It seems like it's a normal process, but our home in Vegas sold within 3 days, and so we're going to be signing on that shortly. And we have a home here. I am in Sparks, and so and so excited for that. And my family will be coming up shortly. My children will come this weekend to come visit. Well, 3 of them out of the 4, but just coming up with my mother for a visit, and we'll be back and forth, but we should be here towards the end of June. But all is going well. Such a wonderful community, and I'm definitely enjoying the cooler weather. I always walk out, it's 100 degrees already, and I walked out, even walking here in the middle afternoon. It was a cold blast when I walked out that door, and I'm like, that is delightful. So very, very happy about the weather here. So and also community, it's been wonderful for the time I've been here. So thank you.
Well, I know he's hit the ground running, and I know the staff has really helped a lot. So thank you, staff, for all that you do. It definitely, our goal is, without question, you can miss Kevin, but we want this as seamless as possible, that we can walk forward and let Chad develop where he wants to develop and grow naturally. I want to tell to our board, we are going to try to do a VIP kind of gathering. It's coming up, so you're looking for that. Our goal in that is just to have as many people that we think should meet Chad. And if there's anybody in the county or any of the different things that you think should be more of a one-on-one conversation, let us know, because we'll help set them up and make sure that happens as well. So with that said, welcome, good job. And we are now to the point of board comments. Any board comments? Do we have an ending of public comment? No? Okay, very good. Well then, Kevin, once again, you even stayed throughout this whole meeting. You're a broken man. What are you still doing here? But we are so honored to see all that you've accomplished, but also that you get to go fish and enjoy maybe even take up golfing. So many blessings to you, sir. And we are adjourned.
Recording stopped.